Let's bring in ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, for more on this. Dr. Patel, how easy is it for something like this to happen?
Such an incredibly sad case. And Diana, it is relatively rare. It's not that easy, if you will, to have water intoxication, really, until you're really exceeding the amount of water that your kidneys can clear. So you'll sometimes hear the recommendation to not drink more than 1 liter of water per hour. That's because we need to be able to drink water, but our kidneys have to keep up with removing it. And if our kidneys can't do that, sometimes this throws off the electrolyte balance, especially sodium. And if our sodium levels get too low because it gets diluted with too much water, that can be devastating, causing altered mental status, confusion, nausea, and if untreated, can lead to seizures, coma, and even death.
Dr. Patel, people chug water all the time. It feels great, especially when you're hot or thirsty. So how do you know if you're overdoing it?
That's why it's so important to drink water and space it out throughout the day rather than chug it. And in this country, some of the cases of water toxicity we do see are actually from people chugging water, or they're doing it as part of some type of contest. We've even seen cases during college parties or contests or hazing with people chug too much water. So what you want to do is space out your water drinking throughout the day. Try to avoid drinking more than 1 liter per hour. And if you are in a place where you do feel like you have dehydration or you overexerted yourself, you may want to consider first seeking medical care, but also consider bringing a sports drink, something that has electrolytes in it, especially if you're doing some high intensity training while it's so hot or humid outside.
Dr. Patel, any other general tips to stay hydrated or rehydrate safely?
I think the biggest tip is to pay attention to what's happening in the country right now with how hot it is and realize that everyone out there is at risk of dehydration. And then this could lead to you grabbing bottles of water and chugging them. So make sure you keep water with you. Make sure you have an action plan for staying away from the sun. Keep electrolytes with you if you're doing a specific activity. And remember that some of these symptoms of water toxicity can be kind of ambiguous. Disorientation, confusion, feeling nauseous. People may not think there's something wrong, but that's why it's so important that when in doubt, you seek medical care and you try to pay attention to what you've been taking in and all your exposures throughout the day.
All right, ABC News medical contributor Dr. Alok Patel. Thank you, Dr. Patel.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.